I am Dr. N.K. Venkataramana, neurosurgeon, Brains Super Speciality Hospital. Golden Hour is an initiative of a Brains Hospital to promote the concept that every medical or neurological emergency need to be treated within the stipulated time. For every condition, there is a primary damage. For example, if there is an accident, there is a primary injury and that lasts for a few seconds. After that, there will be a series of secondary damages because of bleeding, lack of breathing, insufficient oxygenation, vomiting, aspiration, convulsions, and several of these complications can happen within the first few minutes to an hour after the primary injury. So, this first 1 hour is called the crucial golden hour, wherein people require support and every secondary complication is preventable. And if we can try and prevent every secondary complication, majority of the primary injuries can be recovered very well. Otherwise, a simple primary injury, for example, a brief loss of consciousness because of a concussion in an accident, can get complicated if the person is not breathing well for a while or his blood pressure is low for a while. Brain will not get oxygen or blood supply and there can be a permanent damage. Whereas, if these things are taken care of, the primary injury can be quickly recovered completely. This is not only for the accidents, is applicable for every medical condition and every medical emergency. So, whenever there is a medical emergency, it may be an accident, it could be a stroke, it could be a spinal injury, it could be an epilepsy, it could be any severe medical problem. A, B, C is very important. A stands for airway, B for breathing, C for circulation. If these three things are not taken care of, the primary problem is going to get complicated manyfold. So, whereas this problem is going to happen is that medical emergencies happen at the different locations. From that point of the area till he reaches the hospital is the danger zone wherein no supervision is there. So, every time people think that if there is an emergency, the treatment should begin in the hospital, which is not true. The treatment should begin right from the scene of emergency. From that point till they reach the hospital, airway, breathing, circulation, neurological state has to be protected completely, so that when they reach in the right way, to the right place, in the right time, by using right method, then whatever technology skill available in the hospital can be applicable and they can recover very fast. So, if we act in the right time, we can reduce the complications, we can reduce the death rate, we can reduce the disability, we can improve the quality of life, we can also bring down the medical expenses. So, this is the concept which is applicable particularly for the head injury, stroke, spinal injury and other medical emergencies, wherein the person need to be transported to the hospital in the right way, taking care of all the airway, breathing and circulation, so that secondary complications can be completely prevented. This is the concept of golden hour and we are trying to promote this to create awareness, so that everyone should reach the hospital in the right way and in the right time, that is a golden hour, so that when the right kind of treatment is given, the outcome should be in the right way.